Hello, Joe, Seth, Zach, Eric, Brian, Timothy, Chad, Jason, Mike, Steve, and Dan. Today I'd like to present to you the case of Barbara Lightning. She's a patient who has multiple sclerosis, and my group looked at a physical therapy plan of care for outpatient and a long-term setting. So when reviewing Barbara's past medical history and the course of her progression, it seems that her multiple sclerosis will continue to decline at a fast rate. She was diagnosed 14 years ago, and her symptoms are becoming more disabling, especially over the past 5 years. Her most recent exacerbation was 2 weeks ago and has left her homebound and mainly in her recliner. Barbara's goals include wanting to remain independent in the community. She wants to return driving. She'd also like to go to the store that's a block away. She would like to walk independently in her house without the fear of falling. She'd like to be independent with transfers and transitions. She'd also like to shower and dress independently. If Barbara's condition continues with the current pattern, she will be able to meet some of the goals. However, they will need to be modified. So in order for her to meet these goals, long-term physical therapy care is necessary. And with some recent research, exercise has been shown to help slow the degenerative process of multiple sclerosis. Some authors have stated that aerobic exercise can offset the difficulties, especially depression, fatigue, and deconditioning that's often associated with the disease. There's also positive gains shown with aerobic fitness, fatigue, physical activity, and health perception when performing aerobic exercise. And in a combination of aerobic exercise and strength training, there was shown a diminished motor fatigue and an increase in strength. So it's important to keep in mind that when creating a long-term plan for Barbara, that contemporary research should be looked at, and all training regimens should be initiated slow, progress slowly, and at the comfort level of the patient. So some interventions we looked at were stretching, strengthening, conditioning, and endurance exercises, as well as some aquatic therapy. Stretching involving the cervical region, the trunk, and the extremities. So general stretching should be performed daily, 10 to 15 minutes before and after aerobic exercise or resistance training. Upper and lower body, as well as the cervical region and trunk, should all be done slowly and progressed slowly as well. And then some research has shown to hold it for 20 to 60 seconds, and it should not be painful, so the gentle and prolonged stretching. A few exercises we discussed for the trunk that may be a little more difficult than the extremities or cervical region would be to lay supine or prone over an exercise ball. If the patient is unable to do so, you can use pillows over or under their stomach or back on a plinth, which may help stretch the stomach or low back area. Strengthening, resistance training, weight training for upper or lower extremities and the trunk. You can use elastic bands such as TheraBand, free weights, machine weights, or any sort of pulley system. All are sufficient for strengthening with a patient that has MS. So some other research suggested that you should target the legs, back, shoulders, chest, and arms, and then obviously anything specific that the individual needs to work on. They said that it would be okay to safely increase the resistance by 2 to 5% when using 15 repetitions per week, but again, everything is going to be patient specific, so you're just going to have to adjust accordingly. Some conditioning or endurance ideas include walking, a possible light jog, a stationary cycle, so that could be upper or lower extremity, so the UBE, or just a regular stationary cycle for lower extremities. And then some aquatic exercises. It's important to keep in mind that the temperature of the water should be about 27 to 29 degrees Celsius, approximately 80 to 84 degrees Fahrenheit. You can work on range of motion as well as strengthening. That may be beneficial if they can't completely go against gravity. So if they've got a MMT of 2 or less, aquatic therapy may be beneficial. But again, keeping in mind that you want to keep that core temperature down, so definitely checking the temperature of the water. Some patient and or caregiver education, discussing a possible skilled nursing facility, either a home aid, also grab bars, handrails, anything that may be assistive in the home. Also discussing assistive devices such as walkers, wheelchairs, or potential scooter. Again, if her condition continues to progress as it is, wheelchairs or even a power wheelchair or that scooter may be the result of the disease. If her upper extremities start to lose strength or become fatigued easily, she wouldn't be able to propel herself in a manual wheelchair. So just some things to consider. Currently, she's also having some cognitive issues. So when talking about assistive devices, it's imperative that you look at or assess her cognitive function for safety concerns. You definitely don't want her crossing the streets or going downstairs or anything impulsive that may involve her safety. So basically with all of that, we just want to look at energy conservation techniques, which is a big thing in MS. So anything that can help her perform her ADLs but conserve her energy. We also looked at a few referrals, so looking at an ophthalmologist if her vision continues to get worse, which it often may, especially in patients with MS. Looking at referring to an OT that may help with specific adaptive devices for ADLs, so just different things in the home may be beneficial. Speech therapist, she was having a little bit of difficulty swallowing, so the speech therapist may be beneficial for that. Potentially women's health physical therapist, so if urinary incontinence becomes an issue later on, as far as muscle control, a women's health PT may be really beneficial for that. Also considering an orthotist and a psychiatrist